A new law meant to protect Colorado's most vulnerable patients has some of our most vulnerable hospitals concerned. Because in rural Colorado, it can come down to dollars and whether hospitals can do what's being asked of them. Our Anusha Roy takes a look.
The goal of this new law was to fix a past law from a decade ago that required hospitals to help patients who could not afford their medical bills.
Unfortunately, what we saw is a high level of inconsistency in how hospitals were implementing that 2012 law.
Adam Fox with the Colorado Consumer Health Initiative said that meant some patients had no idea they could get discounted care or help to navigate the application.
Some people end up putting those bills on credit cards that take years to pay off if they are ever able to.
So Fox's organization helped make HB 21-1198 a reality to create a uniform system.
More of the cases that we have seen are from sort of the Denver metro and sort of suburban areas. But that's just because we have a higher population there.
We certainly support the intent.
But at Lincoln Hospital in Hugo, Kevin Stansberry said that uniform system is hurting them. For example, how much a patient pays is tied to their income, which plays out differently in rural Colorado.
They're small business people, and so their incomes are varied based on how the harvest is going or, whether they sold their cattle at what price or whatever.
Stansberry said they have a charity care policy,
admittedly pretty informally, but we were doing a good job with it.
But are now having to hire more administrative staff instead of spending it on patient care when their budget was already tight.
It may mean fewer services that we may have.
We absolutely recognize some of the challenges that this has caused, particularly for our rural hospitals. And we've been working with the rural hospitals and with the Colorado Hospital Association to address the administrative burden wherever we can.
Nancy Dolson is with the state overseeing this program, and while she acknowledged that hardship, she said at the core of the law are the patients, a law that's been around for years.
They understand what they're going to be charged. They know what their rights are. They receive the discounted care. They aren't surprised by, ending up in collections. That's the last place we want folks to be.
So there is help for rural hospitals through state and federal programs, but this law does not specifically set aside any money to help with those costs that we just talked about that rural hospitals are looking for. And a lot of people, every time we do this story, they say, well, look at how much the CEO and the top officials are making. The only CEO I had a chance to talk today was Lincoln's CEO, and he said the board is generous, but it's not the same as your bigger hospitals where you could be making a lot more money and the impact would just be so different. And that is definitely, I just want to let people know, I keep asking that question and trying to track down the info on that.
So, as for those bigger hospitals where people are paid more and that kind of thing, the budgets are a lot bigger, but I assume they're also seeing a lot of low-income patients at the big city hospitals.
Yeah, sure. So Denver Health said that they had around 56,000 patients who received that discounted care last year, but said they actually saw very few additional patients under this law. UC Health saying the same as well. Of course, the law is new, so all of the numbers are not out yet, but like you were mentioning, these bigger hospital systems have such a different budget to deal with these kind of changes.
Yeah, without a doubt. Anusha, thank you.